we have in the studio, and I would like to introduce, and please forgive my no doubt mispronunciations, but two gentlemen from South Sudan, the Honorable Tong Aneri, the State Minister of Health, that would be you, sir, and Dr. Machut Achiek. It's close enough? Okay, and Ellen was in here telling us earlier that the situation in South Sudan is not going so well right now. Would one of you care to begin by addressing what's going on right now? Give us a little news update.
Okay, thank you so much. You have heard already my name.
You need to push the mic, pull the microphone right to your mouth, and speak directly into it. There you go.
Thank you so much for inviting us here.
Right in there. There you go.
Okay, good. My name is Honorable Tong Deng. I'm the State Minister of Health in South Sudan. And it is a pleasure to be here today. Just what I want to give you the brief highlight is that, in fact, the situation in Southern Sudan is not very good in 3 states of South Sudan. That is in Upper Nile, Unity, and Jonglei State. That's where there is a conflict at the moment, because we have 10 states in Southern Sudan. 7 states of Southern Sudan are okay, but the conflict is actually going on in the other 3 states.
Yeah.
So what is going on at the moment is to work around the clock to see that the conflict is brought down. And to do that, there is a peace process that is going on at the moment in Addis. They were in the break in the middle, but they have gone back on Monday, and the peace process is going on now. What I will not be able to tell you is what has been agreed, and there is nothing that has been agreed yet, but what they discussed for the last 2 days is what I don't know, because I've been here and they've just started, and the process is actually, can say it's moving on. Okay.
Okay.
So unless you have some more questions.
Well, let me ask Dr. Achiek. Is that Achiek?
Yes. Now, yes, I am Mayan Achiek. I'm a surgeon and an assistant professor of surgery at the medical school in Juba.
I've been to Juba. I've been with all the way up to Gok Machar with Ellen.
It's a pleasure to know that.
Thank you. And good work. So what goatsfortheoldgoat.com, which is Ellen's charity, I know is doing a lot of work in South Sudan. But what do you want people to know about what's going on there and where they can go and what they
really
can do?
As a doctor and as a professional, what I would like the people of the U.S. to know is that we are struggling. Our people are struggling. The healthcare situation is stark, not because of the war, even before the war, because we are forming. The war, of course, has made it worse for the 3 states the minister just mentioned a few seconds ago. But in general, it's tough. It's tough in terms of the resources, human resources and materials. The hospitals are buildings that have been there for the last 60 years or so. They are derelict, and they are really not holding well. We would like people to help us to rehabilitate this while we're working building new hospitals. The government is working hard to build new hospitals in all the main towns and cities of all the states. And also, we have a problem of the human resource, the manpower, specialist manpower, doctors and nurses, and we don't have training institutions that are functioning well. The only medical school that's working at Juba, which is College of Medicine, University of Juba, has a problem of faculty, the teaching faculty. Only 14 senior lecturers, and that's all including the dean. And that is tough. It's not a number. That is not a satisfactory number to train future doctors, but we don't have anyone else. So we're working hard. And that's why we are asking friends, the whole world, to help us. Now we have got 2 nursing colleges. One is working in Juba and is producing a very small number and is functioning. The other one is the one we're trying hard to open in northern Baragazal in Awil. That is going to produce a bigger number, about 120. We are actually aspiring to produce more from there. So these are 2 factories that would really like to produce the healthcare cadre from South Sudan to alleviate the suffering of the people.
Yeah. Is there, Doctor, are there good NGOs that are working in South Sudan that you would recommend people to? And I'm assuming that the U.S. government has been providing some assistance to your government. I guess this is more a question for the minister. We'll get to that in just a second. But first, are there any NGOs that
Most NGOs that are working, they're doing a great job. Some of them are American, some of them are from continental Europe. To mention one or two, like Safe Children Fund, MSF, and CRIC. That all these institutions are doing a good job, and well, USAID as well is helping through some of these organizations. And to mention as well, UNFPA.
Right.
It's also one of those organizations working on. Yes,
okay,
yes.
Right.
We've got a number of them, and especially Northern Barghazal is the best example of these organizations doing a good job. The minister here, credit to him, has internalized them. They are part of the establishment. So they work hand in hand with the counties. We call them counties. I mean, the administrative areas, and therefore they are actually helping actively in the administration and the delivery of the healthcare services. Great. So it's just a wonderful thing.
And Minister, we have maybe a minute and a half left. I'm curious, is the American government helping out, and what other governments are?
Okay, thank you so much. Actually, what I want to tell you that American government has been very helpful for South Sudan. I could say that during the war, the first war, and during the CPA, without the American government, there would have been no peace that has come to South Sudan. So that's something that I want to make it clear. The other thing that I want to say here is that, as you mentioned, you asked about the NGOs that are working in South Sudan. There are a good number of NGOs that are working in South Sudan, and most of them actually are working with us in health, and we have very good relation with them, both NGOs and the UN who are working in health. We work very closely and work together. But I would also like to add a point of what Dr. Mayan has mentioned about Southern Sudan is an area that has a very high mortality rate in the world. There are very, very big mortality rate, and especially with the women and children dying at birth. This is an area that we are working very hard in health to see that this thing has been reduced by setting up the training. And we want to make sure that the training for the mid-cadres level is set up so that we make sure that these nurses, the midwife, are trained and work down within their communities.
That's great.
It's just an example here.
We have to wrap it up. But thank you so much, both of you, for being here. South Sudan, the newest country in the world, an area the size of Texas.